A very good morning to our esteemed panelists, ladies and gentlemen. I'm Dr. Shifa Osman. I'm a resident from Hyderabad, and I am presenting a paper titled Hiding in Plain Sight. It's a case report of a 65-year-old woman who presented to us in the hospital with complaints of fever, chills, shortness of breath, and altered sensorium. Her investigations were suggestive of uremia, sepsis, type 2 respiratory failure. She was managed appropriately in the ICU with broad-spectrum antibiotics, IV fluids, and supportive care. However, despite using high-end antibiotics such as injection meropenem, Piptaz, and Dalasin, her condition did not improve significantly. On day 3, our ophthalmology department was called in for a referral in view of discharge at the medial and lateral canthus of the right eye. On evaluation of the patient by our team, we found that the patient had a stock ocular prosthesis in place over a shrunken, distorted, and disorganized thumbsicle eye, as we can see in the image here. On further evaluation, we learned that the patient had a history of trauma to her right eye about 4 decades ago, and also was habitually removing the ocular prosthesis about 3 to 4 times a day for purposes of cleaning and was very careless with the process. We proceeded to remove the ocular prosthesis out, and on removal, we found a collection of a thick whitish yellow purulent discharge behind the prosthesis, which we promptly sent in for culture and sensitivity. Following this, we cleaned the ocular prosthesis, the underlying cavity, and placed the prosthesis in distilled water. 2 days later, once the culture and sensitivity report was returned, we found that the pus showed a growth of MRSA, and based on sensitivity report, we started the patient on linezolid. Here is where we can see the ocular prosthesis of the patient as well. Moving on to discussion, so methicillin-resistant Staphylococcus aureus was first identified in 1960 and was first confined to healthcare facilities. But now it's expanded its course and now is also becoming a dominant pathogen in community-associated infections. According to a paper by Asbel et al., the surveillance network, which monitors antimicrobial susceptibility pathogens in the United States, reported an increase in the proportion of MRSA among Staphylococcus aureus ocular infections from 29.5 to 41.6%, telling us that MRSA is a rising menace in the ocular field. We already know the established risk factors for MRSA, but now recently more cases of MRSA have been documented among healthy community-dwelling individuals as well. And us as ophthalmologists who deal with patients more or less on an outpatient basis need to be aware of this. A quick note about the formation of biofilms that was published by Michelle T. Sun in 2015 in ocular prosthesis also needs to be kept in mind, as these organisms remain dormant and cause opportunistic infections. On the care of an ocular prosthesis, to begin with, as we know, the whole surface of the prosthesis must be free of irregularities, roughness, and marks, be perfectly polished to reduce chances of bacterial deposits, and should be cleaned, according to Pine et al., should be cleaned no more frequently than monthly and no less frequently than 6 monthly. In conclusion, I'd like to focus on 3 main points, saying that us as ophthalmologists need to be aware that community-associated MRSA is just as common as hospital-acquired ones, and intensivist physicians also need to be vigilant and maintain a high index of suspicion in all cases with ocular prosthesis to catch an infection early if present. And lastly, patients with ocular prosthesis need to be educated and equipped with a better understanding of how to handle and care for their prosthetic eye. Thank you.
Do you agree that the prosthesis has to be cleaned only once a month?
So that's what I found in the literature, sir. But I would expect it to be washed a little bit more frequently than that. Maybe 15 days, 2 weeks.
Yeah, because once a month I think is very
long.
Yeah.
Yes.
10 days is what I had once.
Yeah.
Any imaging or stuff?
Ma'am, no ma'am. The follow-up was once, basically she was very sick when she got admitted, but she went back home walking, but she never came back to the follow-up for the base scan that we wanted to do.
40 years back, what was the reason why the...
Trauma. So she was also a neglected lady. She did not have any family to give complete history, but she said that she had a trauma when she was younger.
Because what happens when the socket is not being taken care of?
Yes,
the prosthesis also, the gate has not been taken care of.
Yes.
So over the period of time, the back,
Yes.
the back portion of the become very irritating.
Yes,
And it
yes.
irritates the surface.
Exactly. Ma'am. exactly,
Okay, and
Amma, yes.
that thing, the superficial part, gets infected also.
Yes,
So
ma'am.